today, or of course our public vaccination centres and also the Commonwealth vaccination centres. So if you are eligible, if it's 4 months or more since you had your second dose of any type of COVID vaccine, you can come and get your booster today. So I'm so thrilled. Mikey's getting his today, as is some of our media here today. So don't wait. Please come out and get your booster. And I also want to say, if you're eligible for your second shot, please don't delay. Our second dose rate should be higher right now based on the number of people who already had their first dose 4 weeks ago. So that means there are some people in Queensland now who are eligible for their second dose who have not come forward. So please come forward and get your second dose as soon as you're eligible. For Pfizer, that is 3 weeks after your first, or 4 weeks for Moderna. So please come out and get vaccinated and get your full coverage as quickly as possible. We've had 5,699 new cases in the last 24 hours. What does that mean? That means, as we have been saying all along, more and more cases are spreading across Queensland. We have 25,924 cases now active in Queensland. So that means that many people that you know are likely to have COVID, and you are likely to get COVID yourself at some point in the near future. And I know just in the last 4 days I've become aware of 3 people I personally know who have been positive. So please, if you have any symptoms, come forward. We have 2 new local government areas that haven't reported positive cases before that are now positive. That is the Northern Peninsula and also Warrabinda. So again, we call on all communities to come forward and make sure that they get their vaccination rates up as high as you possibly can. And it is understood overnight we've had 4 cases in Mornington Island, so they're not counted in today's figures, but I do want to indicate that there's some cases on Mornington Island as well. We have 11 people now in ICU. 2 of those people are ventilated. We have 170 cases that are requiring non-ICU COVID care in our hospital system. And of course, we have many more people now being cared for in their home under our new monitoring people in their home. Remember, we've got information on the website of how to plan for you getting COVID, how to prepare for it, and also how to monitor your symptoms when you do test positive. We've had 33,312 tests in the last 24 hours, and we are now at vaccination rate of 90.76% first dose and 86.82% second dose. We are creeping slowly towards that second 90% double dose, but we do need people coming out and getting their vaccination on time. Now, I do want to remind people there is very long lines at our testing clinics across the state right now. We've had a number of private pathologists who have not been open over the Christmas period. Some of those will reopen today, and I can advise that our website has shown that private pathologists were to be open today, but we have been advised overnight that in fact a number of private pathologists are not opening at the moment. So there are 5 4-site drive-through sites that are not going to reopen until the 9th of January. That's at Deception Bay, Ipswich, Goodna, Ipswich South and Britannia. There's 8 QML drive-through sites that are not open today, and we're still trying to get clarification from QML when they expect those drive-through clinics to be able to be reopened. I understand that's got to do with around staffing issues, QML have advised us, and we've got 4 Sullivan Nicolaides sites that are not open at the moment due to Sullivan Nicolaides, as I understand, have been engaged by the Commonwealth to go into residential aged care facilities and to do testing there where there's been positive cases. So we know this is putting a strain across the whole testing system, and we do ask for people's patience. I do want to remind people there should only be 3 reasons you come forward and line up for a PCR test. either through drive-thrus or walk-up testing. That is, that you have COVID symptoms. That is one reason to turn up for a PCR test. Secondly, that you have done a rapid antigen test and it's come up positive, you should be coming forward to get a PCR test. And thirdly, you are a household close contact and it is day 6 and you haven't been able to get a RAT test. You can come forward to a PCR test. Now, I can advise we've got 500,000 rapid antigen tests that have arrived in our distribution centre. From tomorrow, we will be dispatching those across our various public testing sites. It will take a number of days to get them out into the regions and across Queensland, but we will make sure that we get these rapid antigen tests to every one of our public testing clinics over the next few days. So as people turn up to testing clinics, they may start seeing over the next few days a separate line. That separate line will be for household close contacts for their day 6 test. They will be able to, instead of lining up and waiting for a PCR test, to collect their rapid test and take it home and test themselves at home. But this will take a few days to get these to all of our sites. So please be patient, but if you are a day 6 test, you may see these lines forming over the next few days. We hope that a number of these private pathologists will be able to come online as quickly as possible to help ease some of these pressures that we're seeing. But I want to give a big shout out to all of our staff and our volunteers who are working these testing clinics, and also to the public for their patience. We know they are long lines. Make sure you're taking water with you, you're preparing for waits at these sites. We know it's important, and I do remind people it should only be for those 3 reasons you come out to get a PCR test, not because you're a close contact in the workplace or you've gone to lunch with a friend. If you don't have any symptoms, that's not a reason to turn up for a PCR test. I'll now hand over to Dr. Gerard just to talk a little bit more about particularly our cases that we're seeing in ICU at the moment. Thank you.
Thank you very much, Minister. So today we have 5,699 confirmed cases of COVID-19 in the 24 hours to 7 p.m. last night. And I say the word confirmed because we know there are going to be more than that in the community that are not as yet confirmed. The percentage of tests that are coming back positive has increased substantially in the last few days. Pathology Queensland is reporting that 23% of the tests that they have taken yesterday came back positive. This suggests that there are more people in the community with COVID-19 yet to be picked up. But of those that we have confirmed, the Queensland's total is now 29,626, with 25,924 currently active. This is a clearly contagious, very contagious virus. But the good news so far, the good news is that of all those cases, we still, as of last night, only had 11 patients in intensive care, of whom 2 were on ventilators. So the disease that we are seeing at the moment bears no resemblance to the disease that was being reported last year, both in Australia and overseas, because of vaccination, largely because of vaccination, and probably also because of the Omicron strain, but largely because of vaccination. There are 170 cases in hospital currently requiring treatment for COVID-19, of whom 36 are unvaccinated. But I repeat, even though the proportion of patients requiring intensive care is substantially lower than what we have seen previously, the numbers of cases we are expecting to see through January will be very high, certainly in the hundreds of thousands, if not more, in Queensland. Okay, very high. As of the 2nd of January, vaccine coverage is 90.76% of the 16 plus population has had at least one dose, and 86.82% of the 16 population has had 2 doses. Now, I understand, with regard to testing, I understand that getting tested now can be very difficult, and my heart goes out to those who've had to wait for long periods of time in queues or have missed out. The nationally agreed position at present, and no doubt these things will change, but the nationally agreed position at present is that a PCR test is advised if you have symptoms, respiratory symptoms, any respiratory symptoms, runny nose, sore throat, cough, fever, headache, then a PCR is currently the recommended test. It's also recommended that you get a PCR test if you've had a positive rapid antigen test. And thirdly, if you are a close contact, that is a household contact of someone with COVID-19, the current recommendation is that you get a rapid antigen test on day 6 if available, but if not available, then a PCR test if you can get it. Now, if you are sick and not easily able to get tested at present, please stay at home. Assume you have COVID-19. If you are experiencing the following symptoms, then I suggest you seek immediate medical advice or call an ambulance. That is if you are breathless, thus you have significant breathlessness, chest pain, fainting or severe lightheadedness. And also I would suggest that you seek medical advice if you have not got a clear diagnosis of COVID-19, if your symptoms are continuing and not improving after the 3rd day. Again, I must emphasise the vast majority of us, if we get COVID-19, particularly if we are vaccinated, will have a mild illness that will be very similar to the cold or flus that we've had in the past. And most of us by now, will know at least one person who's had COVID-19. I now know many people who've had COVID-19, both here in Queensland and in Sydney, and in all cases their illness has been mild. Thank you very much.
Dr. Gerard, could you request that the private pathology clinics stay open over the festive period, like yesterday, for instance?
I don't think I'm in a position to make that demand of the private sector.
Minister, maybe that's a question for you, because in anticipation of what the Premier foreshadowed as the inevitable spread of COVID ahead of the border reopening, was a meeting, a summit, if you like, with the private pathology clinics to discuss the Christmas New Year roster, a priority for your government?
Oh, absolutely, and we are in regular communication with the private pathologists. But up until yesterday, we assumed many of these sites that I'm talking about today were going to be open today. But some of these are due to staffing issues, and we understand that. Some will be because staff have turned up positive themselves, or they are close household contacts and they're needing to stay away from the workplace. So we know that that causes pressure on the system as well, and I in no way criticise any of these private pathologists for not being able to open today, but I do need the public to know that these sites aren't open despite what is available on the public.
Did the government,
Before we open the borders to ensure that we had it all under control, there's nothing to worry about. Now, there were people lining up for 4 hours going to these sites.
This is happening across the country. This is happening across the country.
It's 9 wrongs make a right, Minister. I mean,
we're as prepared as we can be. We are as prepared as we can be. Have a look what is happening around the world. This is not unique to Australia. There is not one country, there is not one state who can say that we don't have lines, that you won't have to wait for a test. Now, it was myself only a few days ago said, when we shift to the rapid antigen test, which people have been calling on, there's still going to be an issue with availability. So we're sourcing those as quickly as we can, and we know that once our private pathologists are able to come back online and we have the rapid antigen tests circulating throughout the community, readily available at pharmacies and supermarkets, as well as being provided by the public clinics, that will take pressure off. But for some time now, we're still going to see lines of people needing to get tested.
So there's people being turned away, though. That's the difficult thing for people. We're standing here now, so come forward for testing. Our top doctor is telling people to come forward for testing. But Sunshine Coast, the Gold Coast this morning, people ringing newsrooms saying, we're being turned away, we can't be tested.
And some of the ones that are being turned away, I understand, are traffic issues with some of those sites. We will continue to work with the private pathologists. Remember, we can't do this alone. It has to be done cooperatively across the public and private system. I will be contacting Greg Hunt today about Sullivan Nicolaides going into residential aged care and whether there should be some consideration as to whether they should shift to rapid antigen tests as well, because they're doing screening at the moment. Now, it has been part of the protocol that the Commonwealth uses private pathologists to go in where there is an outbreak in a residential aged care and do PCR testing. But we do need to rethink that if it means that we're taking other private pathologists offline who were running drive-through clinics. So I'm going to have a chat with Greg Hunt about that today.
The Minister was always in question, wasn't it? I mean, that's what saw at the end of the day 5 PCR test for visitors, wasn't it?
We
You
have
said it
to
was very
move.
important, yet within 2 weeks of you saying that,
We
Dr.
have to
Ferraro
move.
made the point that it just had to go, that it wasn't a priority.
We have to move to these new stages. As cases grow, we will continue to adjust the modelling, and as Dr. Gerard just said, right now there is a national guideline as to who should turn up for PCR. That should and could change again any day. So we're constantly changing to adapt to the new settings.
Minister, did the government though specifically ask those private pathology providers to stay open, say, yesterday? Was there an actual request? You said you
Well,
assumed they would, but did
Well,
you ask
we reached out to them to see how many were opening and if they could open. Of course, we want them opening up as quickly as possible.
Asked them to stay?
My understanding is that we reached out to all the private pathologists to talk about them opening up after the Christmas
And what
break.
percentage of them did open?
Well, there is around 200 private pathologists operating testing across Queensland. There's 17 that I'm aware of who can't open
Surely they
today.
get a phone call to say, open up.
Well, we
need
can't
you, or-
direct a private pathologist
But
to
I mean,
open
this
up.
It's a health crisis.
We-
you know,
we
that's
need
what
it.
they
We
do.
need it.
Of course,
Minister,
but we can't force their staff to go to work if they're positive.
Are
We
they
just
able-
can't ask
are
that.
pathology staff able to access PCR tests quickly to get their rapid antigen test quickly so they can find out quickly, or are they joining the queues at other places? I mean, we're getting
Well, again, they would have potentially their own access to rapid antigen tests for their staff. So their staff could do the same tests as anyone else as far as if they're a household close contact. But if they're a household close contact, they may very well have to quarantine for those 7 days. So, sorry? Yes. We do have our own stockpile for our staff, for our health workers. They're already in use now. And of course, as I said, we've got 500,000 that's arrived in our distribution centres right now that we'll be
10% of
distributing.
the population, you're telling people to get out there, take the rapid
We
antigen
are-
test,
we are
getting
seeking
them
to-
get booster shots, which aren't available until February for most people when they go online. There's such a big gap between the rhetoric and the reality of the situation, isn't there?
Well, everyone is doing their absolute best. This is a national issue that everyone is working together. We are seeing lines all over the country of people trying to get tests. We know that there is not sufficient supply of the rapid antigen tests at the moment, and there is supply ordered right across the country. We're grateful that we've got this supply coming today and that we can start distributing it for people who are close household contacts. But of course, we want to see these tests being made much more available for our supermarkets and our pharmacies
So what would
as
you say to
quickly
90%
as
of the
possible.
Queensland population, what would you say to them today? You're urging them to get the rapid test, not get the PCR test, minimise the queues, as you say, in line with the National Cabinet guidelines. What do you say to 90% of Queenslanders who can't get their hands today on a RAT test kit? What do you say to them? You're appealing to them to do it. but they can't.
No, I didn't say that. What I said was these are the people who should be coming out and getting a PCR test. Dr. Gerard has just said, if you are symptomatic and you aren't able to get a test today, you should assume you are positive and follow all of the advice as far as precautions for COVID until you can get either a PCR or a rapid antigen test.
Given the Charter said that there's going to be you think it's time now to cut that screening test for travellers coming interstate?
Well, it gets scrapped at the 90% mark.
Are we worried about
a lot
them?
of people who haven't had a holiday all year, health workers, are trying to get a rapid test to have, a week off before the hospital stuff going into overdrive
Again, we'll
Do you
take
think
advice
they
on that.
should be taking rapid tests?
We'll take advice on that, but it was only a few days ago where we were being told that Interstate was overwhelmed at testing clinics for PCR because it was travellers to Queensland. That's what we were told. We scrapped that and we made it the rapid antigen tests, and we have not seen a decrease in those lines interstate.
Because
So let's not assume
no one
that.
can get the rapid antigen test. That's why we can't get them. People line
Well,
up
and
try and get them. There's
again,
pharmacies,
I would
shopping centres.
appeal to
We don't have the-
I'd appeal to the TGA that to fast track as quickly as they can any of those tests that are still in the approval process. Of course, we want the approval process done properly, but there are manufacturers here in Australia right now who are waiting for approval through TGA. The more manufacturers we have in our own country and not be reliant on anything being shipped into Australia, the more we can produce this in Australia, the better we'll be. We'll be able to get it out into Queenslanders and Australians' hands far quicker.
That 90% double dose target again, though, because it is,
And
as
we're
I said,
lingering.
we're creeping towards it. When are we going to make it? Why not say now, okay, we'll scrap that requirement?
We-
because we're,
We still have to remember. We still have to remember that these tests are trying to slow down the volume of positive cases coming into Queensland. So we have to remember why we put those measures in place. If the advice is that the risk is so low that we can move away from that, then we'll take that advice. But right now, our plan has been out there for some time now that we will not lift those tests until we hit 90% double dose. And of course, we...
Could I just ask a question, just in relation to children needing to be moved to hospital for surgery? They're unvaccinated if they're, not able to get it at the moment. They have to have a negative PCR within 72 hours of being admitted. How are you going to guarantee that they will have that result back in time and not miss their surgery?
Well, I'll get Dr Gerard to talk about the circumstances around children and surgery. Just in relation to has the Chief Health Officer given that advice, I can advise no. There hasn't been any advice to shift away from our 90% double dose plan at this stage. Yes.
Are you aware of any labelling mistakes with COVAX as they've been taking tests? We've been hearing reports that people are being told, oh, your test is invalid because there's been labelling errors.
And now you have to be retested.
Look, I haven't been briefed on that today, but I'm happy to follow that up and see if Health is aware of that. I'll just get Dr Gerard to talk about the children's hospitals.
Just on to my question about whether or not you think rapid test screening is still necessary for interstate travel now. You said a few weeks ago we're moving towards a more national approach.
Yeah. I think the first thing to say is that the Omicron strain really has changed everything. And I know it sounds like a cliche, but that has completely changed all the planning. I mean, when one person is on average infecting between 7 and 10 others, that's what some of the figures are being quoted, that bears no resemblance to the COVID that we've been dealing with right up until now. And so all of our settings are changing very rapidly, and we, as the AHPPC group, the Chief Health Officers, the Chief Medical Officer, we have been meeting every day right over the Christmas period, changing protocols, etc. On the specific issue of the border testing, I'm not going to make any specific comment about that, but we review all of these things on a daily basis to see how best we can direct out the testing capability and what the future role of PCR and rapid tests will be. And this is a problem right across Australia. So it's not at all unique to us because of this Omicron pandemic.
Consistent messaging has centred on the importance of the booster shot, so it
Yep.
provides a stronger
Yep.
immune response and actually getting Omicron
Yes.
that many more antibodies are released. But
Yes.
for the average person trying to book that booster shot now that the 4-month threshold has been established, the availability seems to be around early February, yet the threat is upon us now. So concerned about the gap. Is there a problem with the booster shot?
I'm aware of clinics with capacity, so I can't I've not heard that delay until February. Our clinics have had capacity to vaccinate substantial numbers of people in the last few days. I can't say specifically about the future capacity in the next week or so.
Doctor, just moving forward, you said hundreds of thousands of cases.
Yep.
Would your advice to people be, hey, look, if you've got it, you know, you're an adult, you pretty much know you've got it. If you've got those symptoms you talked about, why not the direction to people be stay at home? Don't come out and get a test. If you think you've got it, do a clear period of what you're saying, if they're double vaxxed. So they do a week at home. And then don't come forward for testing. Yes, you might know that they've got it, but if they've got every symptom, you've just told people to assume, yes, they've got it. Why don't we just stay at home that week?
Well, that is effectively what I'm saying if it's not easy for you to get a test. So if it's not easy for you to get a test, then assume you are infected. That is, if you've got the respiratory symptoms, sore throat, runny nose, cough, headache, fever, and you're not unduly sick, which is what is the case with most people.
And that would be sort of a 7-day period?
Yes, you go home, stay. But as tests become more available, hopefully more rat tests will become available, then we should be able to get access to them. But for the moment, that is not an unreasonable one. That is precisely what I am saying. If you're a healthy young adult, particularly if you've been vaccinated, you have something that looks like a common cold or flu, assume it's COVID, stay at home. But the things you've got to look for, if you're becoming short of breath, chest pain, feeling significantly faint or fainting, and particularly if your symptoms aren't clearly, particularly fever, is not clearly improving after about 3 days. Most people are getting better within about 1 or 2 days.
So that's 77% of the people who are getting negative tests from the current testing. It's 23% testing positive, you said.
23% of the tests in the Queensland pathology testing sites yesterday were positive. Negative.
They fought with symptoms, but turns out...
Well, there are a number, but there may be other reasons. They may have been contacts. There are many reasons why people are presenting. They may not have all come because they had symptoms.
Are they sort of people that should stay at home rather than get on the queue, in other words?
Yes, it is true that some people will have a common cold. It won't be COVID, and they won't be able to get a test. Yes, they should stay away. They should assume they've got COVID. As it is at the moment, they should assume they've got COVID.
So if that happens, and the percentage of people testing positive goes up as a result, there's no need to be alarmed by that, is it? Because if the queue's shortening, those people in that 77% cohort decide just going to stay at home and be proactive. So therefore the queues are shorter and those with serious symptoms, it's going to be a higher percentage, isn't it? There's no need to be alarmed by that.
Well, it is. When we get high percentages like that, I mean, up until now we've been running percentages of less than 1%. That's the sort of comparison. When you're running percentages of 23%, that means there are a lot of people that we're missing.
Dr. Were you serious?
I didn't actually quite catch it, and I may not be able to answer. But
Just with children, in relation, if they need to be admitted to hospital for surgery, they have to have a negative PCR within 72 hours of that surgery. How will you guarantee that they will get that result back in time for demand?
I think the individual hospitals will have their own arrangements in those circumstances. I can't comment on specific circumstances or specific hospitals. I would hope they would have their own arrangements. I don't know more specific. I don't know anything more specific.
We jumped ahead, so we might just get a few years to just...
It's the case is before the coroner. I can't comment on it.
No comorbidities, doctor, as far as you know, there wasn't a pre-existing...
No, the case is before the coroner. I really can't comment on it.
Thank you. I was happy to watch. Suffice to say, our compliance operation is very high still, so I'm not going to go into that, but happy to come back to it if needed. But I do want to focus on one aspect where I appeal to the community to try and do a bit better, and that's mask wearing. So yesterday we handed out 575 masks across the state. Interestingly, we ran a targeted operation on the Gold Coast looking at mask wearing, and 529 masks were handed out, and 5 on-the-spot fines were issued to people, all in Pacific Fair. There were a further 67 people that were carrying masks that were required to wear them and could have worn them but weren't, and were asked by police and then put them on. That's really not good enough. What we did see was that there was a high percentage of these people that are not wearing were visitors to Queensland. So the message to our community and to those visiting our states that mask wearing is incredibly important at the moment, and there are requirements to do that. We have worked very hard all the way through this pandemic to take a very educative approach. So we hand out masks, we've handed out thousands and thousands of masks, and there are still people in our community that are not getting it in terms of when they should be wearing it. So please, we'll continue to run these targeted operations. We're very patient and we'll continue to be patient, but anyone that's doing the wrong thing can actually expect to receive a fine, as 5 people did yesterday. The only other thing I'd like to mention, if I could, is the weather. It was disappointing to see yesterday that there were a number of rescues across southeast Queensland on our beaches. The hazardous surf warning remains in place from Fraser Island to the coast, to the Gold Coast, to the border. So please, everyone, go and look at the surf and please stay out of it. You're putting other people at risk if you go into it. Thank you.
How many staff are you losing to COVID at the moment, and are you COVID?
So at the moment we have 89 members that are positive, and that includes 68 police officers, and we currently have 180 in isolation. Look, our business continuity plans are very good. We're not seeing any pressures in particular anywhere. We're coping with it at the moment, but we're increasing internal vigilance and putting additional requirements on our workplaces to make sure that we can keep our business going.
And officers are manning some of these queues, these testing queues. Are there any problems there that you're noticing?
Look, as the Minister said, we've got to ask people to be patient. We understand that people turn out wanting to get a test and they're frustrated if they can't. That is not the fault of the people working in these places, so please remain patient. Similarly, as we want people to get out and be vaccinated, so if you're in queues waiting to get vaccinated, please display patience. Our officers are out and about. We did arrest a person yesterday in Cairns who, as well as not failing to follow a direction under the Chief Health Officer's directions, was arrested for a public nuisance. So we know that sometimes the behaviour gets out of control, and we'll take action where we need to.
Minister, the Prime Minister's copping a lot of heat for not making RAT tests freely available to the Australian public in the same way that vaccines were. Is that something for which your Premier pushed hard at National Cabinet last week?
I wasn't in National Cabinet, and the Premier does not talk about what is discussed in National Cabinet.
With your own health minister?
Well, I'm not going to discuss publicly. I will not discuss publicly what happens in National Cabinet. It is not appropriate to talk about what happens in National Cabinet. The Prime Minister can talk for himself as far as any report. I have already been on the public record saying that I think they should be heavily subsidised or made available free, because we don't want to end up in a society where only those who can afford it get tested to find out if they're positive or not.
Are you concerned about the black market, that these things get in the hands of the wrong people, charging extortionate prices?
Look, I believe that I saw some reports this morning that maybe the community pharmacies are asking for the GST to be removed from it because of that concern about price gouging. I think all of these things have to be looked at by the Commonwealth, because we do want to make sure they're affordable. We do want to make sure that people have easy access to them, and we don't want to become a society where, you know, only those who can afford it get tested. So.
Last question is now.
Not to make public yet the Child Health Review Board's annual report.
You would have to ask the Minister responsible for that. I'm not sure why it hasn't been. I don't know when it was due to be tabled, so you'd have to direct that.
The government received it in October and hasn't made it public.
Look, I couldn't comment on why that report hasn't been tabled yet.
Is it acceptable that 10 children died under the watch of Child Safety last year because of neglect and abuse?
Having been the former Attorney General, can I say it's a sad reflection that sometimes parents do not do the right thing, carers by their children. It would be wonderful if everyone loved and cared for their child the way they should be, but sadly some awful things happen in society, and no matter how hard our child safety staff work, how hard our courts and our police and everyone involved works, sometimes children's lives are lost, and that's why I'm very proud to be part of a government that strengthened our laws around these issues, including changing the definition of murder, because every child deserves to live in a happy household, to be cared for, and not to lose their life at the hands of someone who claims to love them.
Minister, I'm hearing from one of these parents of the children that are waiting to get into hospital for surgery, that the hospital will cancel the surgery if they don't have that hospital.
I can't comment for the individual hospitals. I'm happy to follow up, but I have to. Look, you have to look at the circumstances. I want to look at the facts before I comment. I don't want to make a general ruling that assumes that every child's missing out on surgery. I don't know. I'd like to see the facts of children, you know, and the hospitals have to make, I'm not a clinician, the hospitals make those decisions. They do it for important reasons to keep everyone safe. So I'm not going to comment on individual cases.
Minister, apart from waiting for those private testing clinics to open, what else is the government doing to boost capacity?
Look, we are looking at where else we can boost capacity. But I will say this, and that's why, you know, we continue to ask for people's patience. The people who have been running our testing clinics for 2 years now, the people who have been running our vaccination clinics for 2 years now, or 12 months for the vaccination clinics, have been our health workers. And they come out of our hospitals, they come out of our health facilities, and they come out of our Queensland ambulance service. Now, where we can, we have supplemented them with other private contractors, but those private contractors are also being utilised by other private providers, residential aged care, the Commonwealth. So we're all trying to use the same pool of workers and spread them across all of these services. And you know, for every person I pull out of the Queensland ambulance service to pop up a new drive-up clinic, that puts pressure on the QAS. For every person I pull out of a hospital to run a testing or vaccination clinic, puts pressure on our hospital system. So it's trying to get that balance right. And I want to make sure I don't leave our hospitals short or our paramedics short. Not at all. The reality is no jurisdiction has been able to deal with these volumes of testing without pressure on the system. It doesn't matter how many people. I can put more people on, but then I put pressure on the QAS and our hospitals. So I can set up more testing, but that comes with consequences as itself.
PCR test required for travel, see, that was just pure advertising, wasn't you? Were well aware of just how unrealistic it was.
Not at all.
Just how unrealistic it was with the system to cope with an extra 55,000 people a day. You had to have a mandatory PCR test.
Our job.
Never got anywhere near that.
I take offence at that comment because no, it was taken on advice, on health advice, of how we can slow down the virus coming into this state. When we opened our borders, we were expecting thousands of people, but we ended up with tens of thousands of people, now hundreds of thousands of people flooding into Queensland from interstate hotspots, and we had to do everything we could to reduce the risk of the virus coming in quickly. Now, we have to remember, we opened our borders at the same time as Omicron came on the scene. It was very new. We didn't know how quickly it was going to spread. And Omicron has changed the landscape for every state and territory in Australia. And we had to adapt with that, which is what we did. We only waited just over a week of data. We had 1 week of data to be able to analyse how many positive cases we were getting at the time before we changed the rules. So we weren't complacent. Health has got to come first.
Would you be willing though to be flexible on that 90% target, given
if it is the health advice? If it is the health advice.
On that 90%.
And then are we worried that we...
I think Dr. Gerard has already answered it, but we can ask him again.
Dr. Gerard, though, will you seriously consider that 90% target now and just abandon the RAT requirement for interstate travellers, just given the demand we've seen and these cases?
We're looking at all of these things every day. I even spoke to Kerry Chan about this very issue last night. So we're discussing these issues every day.
So you might relax that target?
We're discussing all issues every day. That's what.
Thanks, everyone.
Thank you.